Hello, I'm Dr. Wally Bartfay, and I'm the Associate Dean, Undergraduate Studies at Ontario Tech University, Faculty of Health Sciences. I'm also the Director for the Bachelors of Allied Health and Health Science programs. And today I have the pleasure of presenting on a wonderful collaboration between Ontario Shores Centre for Mental Health Sciences, located in Whitby, Ontario, and also Ontario Tech University, located in Oshawa, Ontario, entitled Personalized Music Interventions to Decrease BPSD in Patients with Dementia on a Geriatric Dementia Unit, Promoting Patient-Centered Care and Quality of Life. Dementia is a growing public health challenge here in Canada and globally, as shown on some of the statistics provided in this slide. We know, for example, that by 2038, over 1.5 million Canadians will have dementia. It is notable also the cost associated, the cumulative economic burden, will be in excess of $872 billion during this time, and this number is estimated to surpass $1.1 trillion globally by 2050. It is also interesting to note, approximately 9.9 million cases of dementia are diagnosed each year, or one new diagnosis every 3.2 seconds. The prevalence of behavioral and psychological symptoms of dementia has been estimated to range between 35 to 80% of patients with dementia with mild impairments. And of course, various associations, including the IPA, Dementia Action Alliance, and the American Geriatric Society BEARS criteria, advocate and promote non-pharmacological and behavioral treatments as first-line therapies, which include music therapy to manage BPSDs. So music is as old as humanity itself. Archaeologists, for example, have found primitive flutes made of bone and ivory dating back as far as 43,000 years. The earliest fragment of a musical notation was found on a 4,000-year-old Sumerian clay tablets. Also wanted to include an example for the guitar, which is a string instrument. We see here on the right a Babylonian clay tablet that dates to 1800 BCE. And the first electric guitar, which was nicknamed the Frying Pan 1932, I wanted to put the electric guitar up there because it's one of the instruments that I personally enjoy playing myself. So a personalized music intervention is defined as a non-pharmacological therapeutic approach employing music to help clinically manage and treat subjects with a variety of clinical disorders and conditions. So what are some of the positive effects associated with music? Well, music engages many parts of the brain, such as the temporal, frontal, parietal, cerebral, and limbic systems. On the left, we can see the brain at rest, and on the right, we can see the brain's reaction when it hears music. Music also has various other social and cognitive benefits, including enhancing attention, memory, and cognitive function. It contributes to positive aging, and it helps to reduce anxiety, enhances mood as well. The objective of this particular pilot intervention was to examine the benefits of PMIs on managing BPSDs on a geriatric dementia unit located at Ontario Shores Centre for Mental Health Sciences. So we conducted an exploratory descriptive study where we used parametric speakers. Parametric speakers have very focused direction for their sound. And we conducted various sessions, and we assessed both pre, during, and post sessions the effects of these various personalized music interventions or customized playlists for individual patients. We also assessed the total number of BPSD occurrences during these sessions. Here are some of the major results. We saw improvements in the reduction of BPSD symptoms was demonstrated in almost 94% of the time. And following the completion of the PMI sessions, there was also a subsequent post-improvement of approximately 58% demonstrated also. A SWOT analysis was also conducted, strengths, weaknesses, opportunities, and threats, which are summarized in this slide. There was also a cost-benefit analysis. There was minimal cost associated with the actual implementation of the program in terms of speakers, about $60 Canadian. Most of the benefits were, of course, improvements in terms of quality of life outcomes for the patient. In conclusion, these preliminary results suggest that PMI may offer promise as a low-cost, safe, and patient-centered non-pharmacological intervention to prevent the occurrence of BPSD in patients with dementia. These results were published in the American Journal of Biomedical Science and Research. We also subsequently conducted a systematic review of the literature, which was also published in Gerontology and Geriatric Research. I would just like to acknowledge the various collaborators and contributors to this project as shown in this slide. Thank you very much.